ways to think of inflammatory versus non-inflammatory foods, because I had this conversation with like 5 patients today. So inflammatory foods have a tendency to be things like gluten, gliadin, which is kind of very similar to gluten and found in things like oats, dairy, sometimes eggs, peanuts, which are not actually a nut, they're a legume, and they have a lot of lectins, which can irritate the gut. Soy is another one. And anything that is GMO, anything genetically modified. I've been seeing a lot more sensitivities to salmon these days, which is absurd, right? Like salmon should be one of those anti-inflammatory foods. But if it's genetically modified or it's raised and farmed and all of that, then it's going to be more inflammatory than not anti-inflammatory. Normally, anti-inflammatory foods would be things like salmon and things with omega-3s and healthy fats and olive oil and even turmeric sometimes. But turmeric can also be overdone because it's a COX inhibitor, which can over long periods of time technically affect how your gut lining is repairing, things like that. And just anti-inflammatory foods, think vegetables, think colorful foods. Those are all going to be protective. However, if you have food sensitivities to something like blueberries and you have an immune reaction, then that normally anti-inflammatory food could be inflammatory.